Welcome back to Island Life Live, providing a range of behavioral health services on the ground in West Maui and offering special services to wildfire victims and the greater community island-wide. That's Maui Behavioral Health Resources. And joining me now is the Chief Clinical Officer at Maui Behavioral Health Resources, Dr. Lisa Ponichtera. Aloha, Dr. Lisa.
Aloha, thank you for having me.
Hey, thank you so much for carving out some time for us. I know you're super busy now. We've been hearing more and more about this idea of trauma-informed care, and at Maui Behavioral Health Resources, you're shifting to using trauma-responsive care. Can you tell me a little bit about what that means for your patients?
Sure. So trauma-informed care was something that they talked about for many years now, and that's basically giving people information so that we understand how to work with people who might have trauma or experience trauma or secondary trauma. And so what we found is just learning it is one thing. What we did is we embarked on this massive campaign to work with Stephanie Covington, a trainer who talks about trauma-informed to trauma-responsive care. And that's actually how you move from just taking it here into the actually day-to-day practice with the people that you're working with. And we took it a step further because growing up here in the islands myself, as probably many of you there understand, is wellness through aloha, or wellness with aloha, is really where we took it. And so we went trauma-informed to trauma-responsive and wellness with aloha, and used the aloha spirit law. And that's really where we're coming from.
That is amazing. So it's not like a cookie cutter kind of treatment. You guys are actually doing a holistic approach and really thinking about it from the individual client's perspective. I like that. And I think a lot of people might not be familiar with this idea of culturally relevant treatments. Can you tell me more about how that works?
Sure. I think, when I went to school, I was taught for mental health, and I think many of the providers are taught to use Western ways of talk therapy. I think we've had a shift more recently into body type therapies, somatic therapy, hakomi, different types of things where you're actually looking at the whole person, the holistic care. Indigenous practices, if we look back, they already had that. They already used practices like lomi. They already did dance and chanting and drumming and, ipu and ipu heke, and right. They had all these things where they already did that. They activated all parts of the body. And so these are just some of those cultural practices that we need to bring back and utilize as ways to help with. We have to pull everything out right now, pull out all the stops and help.
I love that. It's reminiscent of our ali'i, how we had the ancient practices and also the modern day conveniences, and they brought it together in sort of a hybrid approach. And I like what you guys are doing there. Now, today is the anniversary of the Maui wildfires. Do you have any advice for those having a difficult time right now? Sure.
I think one of the things that I've noticed is that people are going to feel things coming up that they may have thought, this was a year ago. I should be this, I should be that, or why am I not okay? And that's completely normal and expected. Some people might be okay, and some people might be fine, and that's okay also. But if you're not feeling okay, if you're feeling sad, if you're feeling depressed, what happens is it's a natural thing for us on anniversaries of traumatic events to have our nervous system reactivated. And so as those things are coming up, then you're going to have some things that are going to be coming up for you. So what you want to do is you want to reach out and be with your kids and go to the beach, but you want to go and hang out and do things together. And definitely you just don't be alone. We're here, there are many people here, and a lot of this healing is taking place that we're finding it takes place with all the families coming together.
Dr. Lisa Ponichtera, I love the approach that you guys are taking. Thank you so much, Dr. Lisa, for joining us. We appreciate it.